give you a little bit of background about the Menopause Initiative. At the end of 2022, when we were under the New South Wales Liberal government, they announced $40 million funding towards a new menopause initiative where there'll be 16 new services throughout New South Wales for women experiencing severe and complex menopause symptoms. Now, we started planning our service and the specialised hubs under that funding. And then, of course, as we know, we had a change of government to the New South Wales Labor government, who then set their budget in September and decided to still go ahead with the Menopause Initiative. But when we got our funding, it was reduced significantly for the services. It stayed the same for the medically funded hubs, but significantly reduced for the services. So our New South Wales Labor government has committed $37.35 million over 4 years, which takes us to June 27 for 16 new menopause services throughout New South Wales for women experiencing severe and complex menopause symptoms. So we're one of the 12 services, and then there's 4 main medically specialised and multidisciplinary team hubs. So our hub we're connected to is the Royal North Shore hub, which I'll provide you with an overview on this evening as well. So the statewide menopause initiative has the 12 referral sites. Has been emphasised from day one by the ministry that it's a non-medical service. So that's just how the funding went across. So ours will be nursing and women's health physiotherapy-led clinic, where the Royal North Shore hub has received all the medical funding with gynecologists, endocrinologists, rheumatologists, and then they'll have multidisciplinary team, including a psychologist, a dietitian, social worker, and women's health physiotherapist. So ideally, the model is a hub and spoke model, where we have the Royal North Shore hub as our medical multidisciplinary team, and then we will feed patients into that service as needed. So ideally, the ACI have governed this project, and from the ministry has come down from the very beginning that menopause management will and has always been under the care of you as GPs, and that's how they like it primarily to stay. But these services have purely been brought in to enhance the care you're currently providing and to support GPs through education and advice via the Royal North Shore hub. So it's purely just to enhance the care. So with our service being we'll have a nurse coordinator, a women's health nurse, and a women's health physiotherapist. We'll have extra 2 part-time physiotherapists, and then we're employing another physiotherapist altogether just for the menopause clinic. So ideally, we'd like to be able to collaborate with the GPs on the coast and do shared care as needed when women have been referred to the service, or to just for the women's health physiotherapy. And our women's health physiotherapists will be looking at women that are waiting on our gynae wait list with menopause symptoms, so they can be seen even prior to seeing the gynecologist, which will be really good for those ladies as well. So, our service is going to be an outpatient service. We'll have a clinic at Wyong Community Health Centre, which is right near Wyong Station for the people at the north end of the coast, and then we'll have one down at Woy Woy Hospital. Our women's health physiotherapists will be based at Wyong Outpatients and Gosford Outpatients. So we'll be able to provide the patients with menopause and perimenopause education. The women's health physiotherapists have been given a lot of extra equipment under this funding, so new ultrasound machines, a lot of gym equipment. They'll be doing some exercise sessions virtually and face-to-face with their new equipment, and their usual incontinence management that you usually refer the patients through to the women's health physiotherapist for. We'll be providing lifestyle, bone health and dietary education, and we'll be connected to our current ORP service as well. We'll be providing links for the patients on the menopause sites such as Jean Hales, Australasian Menopause Society, and provide education resources, including Healthy Bones Australia. We'll be able to offer care coordination and navigate the appropriate referrals as needed for those ladies requiring dietitian or Get Healthy service or anything else they might require. And also we're having good connections with Nanyara, our Aboriginal health service unit as well. So, and we'll be continually collaborating with the Royal North Shore Hub and you as GPs in primary care. So now the Royal North Shore Hub, so as I said, was funded, it's a medically led multidisciplinary team outpatient service for patients with severe and complex menopause symptoms and management. They are a consulting service, and I have put their complex menopause clinic referral on this PowerPoint, which Sal or Wendy will send out to you if they haven't already, that you can have a look at. Up until now, the menopause clinic they're currently running have been taking all referrals. Now, under this new clinic, they're going to be quite stringent with their menopause referral in intake. So they ideally would like patients that you can still refer straight through to Royal North Shore if you like, with using their clinic referral, but ideally they prefer the pathway to be that the patients come via the Central Coast Health Service first, and then the menqual's done, the patients can have a women's health physiotherapy assessment, bone health assessment, etc., prior to them then going on to Royal North Shore. Just ideally, so most of the consultations done at this end before the patient goes down there. They are going to offer telehealth consultations for the patients as well if they don't want to go all the way to Sydney. They will also be offering, for those patients that are severe and complex and have additional specialists, say, such as an oncologist, they will also be offering multidisciplinary team meetings where you as GPs can sit in on as well. And they'll also be offering virtual consultations if you have your patient there in your room at the GP practice. So that's just a little copy of the complex menopause clinical referral they'll be using. And yes, which will go on our health pathway shortly. That's currently been updated, so that will go on there for you as well. So the Royal North Shore Hub, with their funding, they are also offering a lot of GP education and be collaborating with GPs. They did a lot of surveys just prior to getting their funding on GPs around the Royal North Shore area, and it came back that they would like some more education or just be able to go somewhere for advice. So if you haven't seen already, they're currently doing the Meno Echo sessions. The next one is on the 29th of July, next Monday. I've put in the slide the email address there that you can offer suggestions on specific topics you'd like to have discussed on those, but they've been quite successful, their Meno Echo sessions. They're also going to have a GP advice email for questions, frequently asked questions and answers, and that email service will go live in October. They'll have a fellow-led clinic where GPs can book in a time slot if they need to for advice, and that'll be going live next February. And they'll also be having, if GPs are interested, they'll be offering case conferencing via telehealth. So our commencement date for our service will be the 1st of August, and that's also in line with Royal North Shore. Royal North Shore will currently take referrals, but the official commencement date is also the 1st of August. Our service will take self-referrals, and the women's health physiotherapist would prefer a GP referral just to get an overview of what's been happening with that patient and what treatment they're currently on. The GP referral is required for a Royal North Shore hub if you're referring straight there.